And now bringing it to some of those topics, which can be confusing, is PCOS. And PCOS is one of those terms and conditions that many people hear about, not quite certain of exactly what it is. So I'm going to ask you, what is PCOS?
And PCOS is one of probably the hardest conditions to explain. And so I was thinking to myself, Ian, how do I explain this? It's not one disease or condition.
But tell us what it is in full terminology.
All of it.
We're going to get you down to like the layers of PCOS.
Yes.
Yeah.
So polycystic ovarian syndrome. So it is a condition that's characterized by hormone imbalances. And that can lead to a lot of different things in terms of period health and fertility, and also a lot about metabolic health, weight and insulin and blood sugar, and also your skin. It can cause things like acne and facial hair. So when I explain PCOS to patients, I always have to say, it's not, like I said, it's not one condition. It's not like diabetes. It's not like, a heart attack. Someone with PCOS can have very, very different experiences to, 10 other women who have PCOS. So I always say you only have to have 2 out of 3 things to be called, to have what we call PCOS. One is missing or very infrequent or irregular periods, because a lot of people with PCOS don't ovulate regularly. They don't release eggs regularly. And so if you don't, then you may skip periods. The second category is signs of excess testosterone. So you may have things like the acne, the facial hair, excess body hair. And then the third thing is on an ultrasound, you may see what we call polycystic ovaries. And this is actually something that's very important to talk about, because people picture like giant, like there's huge balloons like in your pelvis. They're actually really tiny. So they're basically the follicles where your eggs are developing in your ovaries. Your body's trying to get you to release eggs, stimulating your ovaries, but they're not quite getting released. So you see on ultrasound all these little tiny dots. We call it like a chain of pearls. And you can see those on ultrasound. So you only have to have 2 out of those 3 categories to be called PCOS. And of course, we would rule out other things like thyroid problems or, other hormone problems. So a lot of people are confused because you can have PCOS and not have polycystic ovaries.
Exactly.
So it's a terribly named condition.
In all the patients that I've seen, I think the name of the condition is the most confusing. And actually, really, it's like a blame game that we're blaming the ovaries when really there's so much more that encompasses PCOS that women sometimes feel a little bit defeated when they get that diagnosis, is because it has to do with the reproductive system. And I think when we think of the reproductive system and anything that may fault the reproductive system, that's where women may feel a little bit ashamed, maybe even not empowered by their body. And the real thing is, just like you said, it has so much more to do with so much other parts of the body that we really shouldn't limit it just to the ovaries. How do you expand that diagnosis when they come in so that they don't feel shamed of their reproductive system?
Yeah, there's so many things you just touched on. One is it's not that your ovaries are broken. People get this impression, oh my gosh, it's my ovaries are just malfunctioning and that's why my hormones are off. First of all, no one really knows where PCOS comes from, but more and more we're starting to understand it as having to do with something to do with metabolism. So insulin, blood sugar levels. Something like 75% of women with PCOS will either have insulin resistance, pre-diabetes or diabetes at some point in their life. So we do think it has something really closely tied with their metabolic systems. And also people will find this out because a lot of times they may have difficulty losing weight. That may be one of the first things that they notice. They're gaining weight no matter what they do. They can't seem to lose the weight. And again, it's not because there's something that they're doing wrong. A lot of times women may get blamed like, oh, you just need to exercise harder, want it more.
Meanwhile, they're probably exercising 6 times a week for 2 hours a day, and still not really looking at why this is happening and what they're doing is failing. So that can be a little bit of an imbalance between the actual diagnosis and what really needs to be done in order to offset some of the symptoms that they're having. Now, when we think about women and how many are actually impacted, how do we look at that from a statistical standpoint?
It's extremely common. So it's one of the most common, if not the most common, endocrine or hormone conditions of women of reproductive age. So it's something like up to 10% of women. So it's millions and millions of women and people assigned female at birth who have PCOS. And we actually think that a lot of people don't know it yet. So there's some estimates of, something like 70% of people with PCOS may not actually even know that they have it yet because, they may not necessarily realize it's a gynecologic condition.
So that actually is impacted because of period culture in general. And that's a global thing, not just, to the US, is when there's something wrong with someone's cycle, it can elicit feelings of there's something wrong, I did something wrong, I may not be able to get pregnant, so I don't even want to find out, and then I don't want to tell anyone. And so when you have patients that come into the office, you said it when we started that you can have 10 women walk in and 10 women have different stories. What are some of those stories that you hear from patients who are walking in?
Exactly. And so, everybody, the thing that brings them finally to the doctor may be so different. One person may have just the crazy periods. They may be skipping periods. When they finally get a period, they may be bleeding all the time. That's actually a very common pattern, is that if you've gone 4 or 6 months with no period, when you finally get it, it's almost like having 4 to 6 months worth of periods all at once. Really heavy, lasts a long time. Somebody may come in because they've been trying to get pregnant.
Yeah.
If you're not ovulating and releasing eggs regularly, it can obviously make it difficult or impossible to get pregnant. Someone may come in because of the weight issue. I'm doing everything possible. I'm exercising like crazy. I'm doing everything in terms of a healthy diet. And I'm still gaining weight. They may come to their dermatologist and say, oh my gosh, my skin is crazy. Like I am breaking out and I have all this facial hair. So what brings people to the different doctor, like I said, may be so different from person to person.
Yeah, and the work that I, do with patients as a gynecologic surgeon, a lot of these patients were coming in because of fertility issues and saying, I can't get pregnant, or I've been to an infertility specialist or another OBGYN. And sometimes the focus can be on something else because we maybe want it to be something else, when really it could be PCOS that's just not maybe appearing in the classical form, or maybe there's a part of the story that's missing. But PCOS is so common, and I think that once women understand that they're not alone, then they really can see themselves and feel more reassured.
Exactly.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.